And I'll introduce myself as well. So my name is Gabrielle Grant. I go by Gabby. I am a registered nurse. I'm licensed in DC as well as Maryland. And I currently work in DC in a long-term hospital ICU. And so I take care of critical patients, a lot of patients who are on a ventilator. So they are dependent to the ventilator for their breathing. Sometimes I do have med surge patients who are a little more active and a little more capable to do more on their own. But in general, most of my patients, they're critically ill.
So, at the hospital, how often do you encounter drug addiction?
It is a hard question to answer because in healthcare and in the medical field, we do take care of pain, a lot. We have a lot of patients who have pain or they have chronic pain that might be from a condition which they have, in their life, or maybe they had a procedure done in the past, or whatever the case is. We have a lot of patients who are already coming to us with pain.
Mm.
And so when a patient has pain, that has to be taken seriously because if you have uncontrolled pain, that can lead to other um, like your vital signs will kind of go out of range. So like
Yeah.
if you're having pain, you can have like tachycardia, different things like that. Your respiratory rate might be elevated as well because you're having this pain, you're so uncomfortable. And that can make things worse when you're already in the hospital setting dealing
Mm.
with something, an illness or infection. You don't also want this person to be in pain, and now they're having physiological effects of the pain. So it's really hard to gauge because in healthcare we do prescribe a lot of pain management, especially in the ICU setting.
Mhm.
Or that type of setting, surgical setting, where we know the patient's going to be experiencing pain. But then there's the other side of it where you might have some patients who they maybe take a little advantage of that they know that we take their pain very seriously. And so maybe they aren't, their pain isn't a 10 out of 10.
Mm.
But when we ask them, okay, where is the pain? How bad is it? They're telling you it's the worst pain they've ever had in their life. So we do encounter that at times. Um, but I would say that it is a little hard to gauge
Yeah.
whether or not someone is kind of, just drug seeking. That could be a term, if
Mm.
the person is addicted, they might be just drug seeking to just get the pain medication, or if they're legitimately, having that issue. Um, then another thing that I wanted to point out is that, I can say that I've seen patients with the aftermath of
Mm.
the drug
The
addiction.
addiction.
You know what I mean? So
Yeah.
like for people who have struggled with alcoholism, you'll see liver damage and cirrhosis because that, alcohol affects the
Yeah.
liver and you know what I mean? So I have seen those issue or different withdrawal symptoms from, people who maybe in their everyday life they regularly use alcohol, tobacco, and now
Mm.
they're in the hospital, they're not getting that. So they get really bad like tremors, cold sweats,
Yeah.
agitation, and that's something that we have to manage as
Mm.
well. So,
Going back to like the root cause of all of this, like what what are like what's some of the characteristics of people who are like who could be more vulnerable to addiction?
well, I think that, one of the questions that you sent me, I think it kind of relates to that. So, I wouldn't say that addiction is a genetic thing.
Mm.
I don't think that it's something that we can say that, a person is born with this
Yeah.
predisposed. However, there are certain cases where, unfortunately, if a mother or a woman is pregnant and she is using the drug while she's pregnant, unfortunately, the child is born addicted to the
Oh,
substance.
really?
And yeah, it's sad. They will have to treat the baby in the NICU, which is the neonatal ICU. So
Mm.
that's like what I do, ICU, except for really,
Baby.
newborn.
Yeah.
And they have to stay there in an incubator. They have to be titrated, the drug. And because addiction, it does become something where it's not just this person wanting the drug anymore. It's like it's now becomes a need, like a
Mm.
physical requirement for their body to like function. So when that's a newborn baby, you can't just immediately stop the drug
Sure.
or
Yeah.
they won't survive,
Yeah.
So you have to kind of,
Like,
wean
data.
them off of,
Yeah.
it's sad. So that
Yeah.
is the case where you can say potentially genetic, but of course
Mm.
the child is gonna grow up. Once they're a toddler, they probably won't, they're not
Yeah.
gonna remember that or anything.
Mm.
So then the other thing is being exposed, I think, at a young age is
Mm.
something that can probably increase the chances that this child would develop that habit in the future. So if it's something where, for example, the child every evening they see mom and dad drinking, they're drunk, things like that, etc.
Yeah.
Then as the child grows up, they might think that that's normal.
Mm.
They always see my parents drink all the time. It's normal. Maybe sometimes they might let them taste it once they're a little
Yeah.
older. I don't know. And then once they grow up, that's going to seem like that's normal to them
Yeah.
because they were always exposed at a young age.
Yeah. That makes sense.
Yeah.
So it's not like directly genetic. So that's like
Yeah,
like,
I would
yeah,
say a lot of it is exposure,
exposure. Yeah.
environmental
Hmm.
factors that come into play.
Like, what are the early signs of like someone who's slowly getting addicted to a drug?
So yes, that's a good question. I looked up some signs. I have a good resource, the
Mm.
Mayo Clinic. So I'm just going to take a look at their website so I can kind of read from here. But they have here on the Mayo Clinic, I can share this link with you as well.
Yeah.
Um, so symptoms of drug addiction says feeling that you have to use the drug regularly. So that could be daily or even several times, multiple times a day. Having intense urges for the drug that block out any other thoughts.
Mm.
Over time, needing more of the drug to feel the same effect. That's something that's known as dependence. So once a person's starting to develop a dependence to a drug or a medication, then that same dose is not going to work for them anymore because their body is already used pretty much to that dose, and now they need something stronger. So that's another way to tell.
Yeah.
It also says here, making certain that you maintain supply of the drug, spending your
Mm.
money on the drug,
Yeah.
if even if not able to afford it, not meeting your obligations and work responsibilities, or
Mm.
cutting back on social and recreational activities because of drug use. And I think that's a big one as well. That might be the best early sign
Thing.
that I would
Yeah.
say, in terms of being able to, or noticing changes maybe in a
Mm.
friend or a family member, someone that is always, calls you, or, you're always hanging out
Yeah.
together, things like that. And now all of a sudden you're kind of like,
Then.
you never can hear from this person, you
Mhm.
call them, they're avoiding your phone calls, they don't really want to go out, and I think that that would be a very important time to check on that person and like,
Mm.
really try to get a hold of them, especially if they're not texting you back, they're not calling you back, just, are you okay? Is everything all right? Maybe ask if they need to talk,
Mm.
because they could be going through something, which is why they're withdrawing themselves away,
Mm. Yeah.
and that's a very big sign, I think.
Yeah.
Mhm.
So do you think this is the same with like young adults, teenagers, or is it something different with adults?
I just think pretty much those you would notice
Yeah.
those same things, kind of like a lack of interest in your activities.
Mm.
That's a huge one, especially things that you were always interested in. All of a sudden you're not interested. That's a big red flag, I would
Yeah.
say. So for someone who's in high school or, a young adult, maybe like it's a sports activity or,
Mm.
something that they always participate in,
Yeah.
and now all of a sudden they are not interested and you never see this person around anymore. You know what I mean? They kind of isolate themselves
Mhm.
and they don't want to eat lunch together. I think that would be a huge sign. um, I do think maybe I would say, like, with young adults and adults, maybe it might be a little, it's you can't really say this. I want to say that maybe it might be a little easier to pick up on with
Mm.
a younger person, because you're at school, your teachers are there, your friends are there. It's like everybody's around you checking on you, then your
Yeah.
parents are, you know what I mean? Not that it's not possible for
Mm.
a young adult to be going through. Obviously, we know that this is a problem, but I just think that there's a little more social interaction with a younger person that hopefully it could be caught
But
sooner.
yeah.
And then when you have someone who's a little older, who's now college age or even past that, that person is not having as much
Hmm.
social interaction.
Yeah.
They might go to work and then they go home. They may or may not live with someone at home. They probably don't have as many people checking on them that they need to speak to on a daily basis, so that could maybe a little
Uh,
go under the rug a little
yeah.
easier. In general, I just think that, if you notice someone's kind of like isolating themselves and withdrawing themselves, I think that, all of us, we should all kind of recognize that as like a big sign that
Mm.
maybe that person is going through something, and maybe we should reach out to them and just ask if they're okay.
So other than just like asking if someone's okay, what are some like other like further steps you could take to intervene in the early stage?
You could, like I said, call to check on
Hmm.
that friend or that person. I would say ask them about, how is work going? How's school? How are their classes? If you know any specific details about, things that they have going on, ask
Hmm.
them those specific questions so they can kind of elaborate. I would say kind of get them to talk about what do they have going on in their life right now that's interesting or that's big or important for them. um Also, are ask if they're under any stress. I mean, we're always dealing with stress, and stressors constantly come at us in life, but just ask them, like, are you, dealing with a lot of stress right now, and what are you doing to manage your stress? I think that's a very important question,
Yeah.
because a lot of people, yes, we have things that are stressing us out, and we're like, okay, it's okay, I'll deal with it,
Hmm.
but how are you dealing with it? Are you dealing with it in a healthy way, or are you, you know what I mean?
Yeah.
You're finding other ways now to manage that stress. So I think
Hmm.
that's a big question to ask. How do you manage your stress? And then this could be a difficult thing for, if this is just someone who's like a friend and you yourself are a young person, you might not really know the best way to help them, but I think just checking on them for one, asking them those questions. And then if you're really genuinely concerned, I would say maybe recommend to them that they try to talk to a counselor or a therapist, someone who is a trained professional to help them with that
Hmm.
problem. Because you, as just their friend, can only help them so much. You also don't want to take that burden onto yourself.
Hmm.
but maybe if you really are concerned, you can say, maybe you can try to talk to a therapist, not in a condescending way or to make them feel bad. You want
Yeah.
to be careful about how you approach that. Um, and then I would also say if you're noticing signs, like, it's a close friend of yours, they're not hanging out with you anymore, and you're kind of concerned, I would maybe mention it to a loved one or a family
Mm.
member of theirs, you know what I mean, especially with younger age. I would
Yeah.
do that, not to say that you're trying to get your friend in trouble or anything, but this is really to help them. You're trying to look out for them, because at least if we can catch this at an early age, at a younger age, hopefully we'd be able to end the addiction and the problem young, before this progresses into something that could end up ruining their life. And so it is very important, I think, in
Hmm.
the early stages to really try to stop the addiction, wean the person off of the
Yeah.
medication. So weaning, that's a term that's used also for like when we're trying to get patients off of the ventilator so that they can get back to a point where they're breathing independently. We use that same term
Hmm.
in term to wean them off of the vent. So I think that, weaning someone off of a medication is also kind of that same thing, where it's you kind of start giving less and less, each day you're taking a little bit less until the point where that's it and you don't need it
Yeah.
anymore.
Yeah.
um, yeah, but I think that the earlier you can catch it is the better, before you develop issues now as a result of
Hmm.
the addiction.
So if you don't stop it in the early stages or around like the middle, still the early stage, but what would happen in the final stages, like in the late stage? Would you say, like, what are some symptoms of that, I guess?
Well, it just kind of it varies. Can't really say there's specific symptoms, because there's so many different things, first of all, that the person could be addicted to. We could be talking about alcohol, it could be tobacco, it could be pain medications, opioids, things like that, which in the long run, there are different, I suppose, kind of symptoms and side effects, I guess, or complications that a person would develop, as a
Yeah.
result of those. So, like with the alcoholism, we know that liver damage, cirrhosis, that's a big issue. With smoking and tobacco use, we know COPD, that's chronic obstructive pulmonary disease, lung disease. That's the big issue now for COPD and tobacco use. And then for opioids, narcotics like fentanyl, pain management, oxycodone, those things can lead to respiratory depression, which is
Yeah.
basically your lungs will just, you just pretty much stop breathing
Oh.
if it's too high of a dose. And then, unfortunately, that's how a lot of people pass away
Mm.
with the opioid crisis. And that's why it is such a crisis, because, like we said, that combination of the oxycodone or fentanyl or acetaminophen codeine, and you have all these medications, and
Hmm.
they slow your respiratory rate as well. That's a side effect of the
Maybe.
medication.
Yeah.
Right. It makes, it relaxes pretty much. It
Hmm.
relaxes everything, including now your muscles. So your breathing gets a lot more slower, more relaxed. And those patients, if it's not dosed properly, they can get to a point where they just stop breathing, and that is how they'll pass away.
Uh,
There is a reversal drug for that,
mhm.
Narcan. which sometimes it will work if used in the right span of
Mm.
time, and the right way, then that can reverse the opioid overdose.
Yeah.
However, that's a whole process as well, and that's not something that anyone ever wants to deal with.
Yeah.
That's like a near death
Hmm.
experience. So pretty much this is a very big deal, a very big problem. And any addiction can lead to chronic health issues as well as, potentially end the person's life.
Yeah.
And then you also have patients who, maybe they don't pass away.
Hmm.
I can say actually a firsthand experience, or one of the patients that I've taken care of recently is pretty young, only 33 years
Hmm.
old, which maybe for your class and your grade, that sounds a little old, but that's pretty
Yeah.
young, in the
Hmm.
grand scheme of things. And this person suffered an anoxic brain injury. I believe she had a cardiac arrest and then was unconscious for some time. But in the history, the individual had polysubstance abuse. So we are aware that the person had, many different drugs that they had been taking. And so maybe this might have led to the cardiac arrest. The person was unconscious for some time, so they at the time they were unconscious, they were not getting oxygenation to the brain,
Hmm.
leading to anoxic brain injury. So now, unfortunately, this person is completely flaccid, only can open their eyes. That's it. They cannot respond verbally. They cannot follow any command. They cannot move any extremity at all. Everything we have to do manually for this patient. This
Hmm.
patient, like I said, breathes through the ventilator, as most of my patients do.
Hmm.
The feeding goes through a peg tube, which goes through an ostomy in the patient's stomach. This
Hmm.
is a very, and unfortunately, at only 33 years old now,
Yeah.
this is probably what this person has to look forward to.
Hmm.
It's very sad, but the chances that this person will regain functioning now with the brain injury that they sustained,
Hmm.
it's
Yeah.
very
It's like
unlikely.
really important to intervene as soon as you can, you would say.
Yes.
Yeah.
Mhm.
So this is kind of a big question, but what policies or like guidelines or any resources could like government or like the society in general like introduce to battle this problem?
Um, yes, that question, it was a good question. I think all of your questions were very good, so thank you. I wanted to find a little more online if I could, but I think in general, some of the government resources that we know they commonly use are like campaigns, so commercials, the anti-smoking campaigns and commercials we see all the time and things like that, anti-vaping,
Mhm.
different advertisements that are against drug use and drug abuse, I think are a big way to just promote healthier lifestyle, and we're pretty much promoting against, drugs and, cigarettes, alcohol. Um, I see a lot of like advertisements just driving around on like a bus. You'll see like at the side
Mhm.
of a bus, or on a billboard. So I think that, our country, they do a good job of campaigns and things like that, just kind of posting the information out there, drugs are bad and don't do drugs. Um, but I think that, maybe we could do a little more as well to promote healthy lifestyle as well as
Yeah.
work life balance. I think that's a big
Hmm.
thing as well, because I think that, a large reason that people or someone might fall into addiction, it could be because of stress. If that individual is feeling like they're stressed out and they're looking for some type of escape from the stress, then sometimes they'll turn to substance.
Mhm.
So I think that as a country and the government, they can try to maybe promote better work-life balance for people, especially for those who work very long hours and they have, not many days off, or
Mhm.
different things like that. Maybe certain companies can work on creating a better work-life balance, I would
Yeah.
say, for their employees, as well as in schools, and creating a good balance as well for their students. I mean, if the student is overwhelmed and has so much like homework, projects, all of this going on,
Yeah.
then you feel like you're not having a healthy balance where, yes, it's important to do your schoolwork, but it's also important to find that time to do something that you enjoy, and
Yeah.
to, both are important. So just making sure that you have that balance, I think. And then another thing I think government could do is maybe making some more free and affordable therapy and counseling services, I think, for those struggling with mental health, because I know that there's a lot of therapy services out
Yeah.
there, like BetterHelp and things like that, but they require, some type of like
Yeah.
membership or subscription, and people can't always afford that. And so I think maybe the government, if they could come up with something, some more like affordable or even just free counseling services.
Yeah.
There are like hotlines out there, and numbers that you can call. But I just think as much as we can put out there as possible, as much help would be better, because
Yeah.
people need help, and it's sometimes very hard for someone to take that first step to even ask
Yeah.
for help.
Yeah. That makes sense. So just make health more accessible to everyone. Just
Exactly.
yeah. Yeah. So some like the overall question I had was, what is one piece of advice that you could give to people, especially young adults, about drug addiction?
One piece of advice, I think that, so what I would say, and that what I wrote down, is that, overall, kind of my whole talk was about stress and managing
Mhm.
stress, or a large part of it. So find healthy ways to manage your stress. That's like the one of the biggest points for me, as well as take care of your body. Take care of your body, like, and it's the only one you get.
Yeah.
Seriously, this is it. Like, you
Yeah.
have one chance. You have one set of hands and fingers, one set of your eyes. That's it. We
Mhm.
need to take care of ourselves, and we see what's going on the outside. Yes, we can go to the gym, we can do these things, but you're not seeing the inside, what's going on with your internal organs.
Yeah.
So diet, all of that is very important. Nutrition. So
Mhm.
eat healthy foods. Nutrition is very important for your physical and mental health, both. Protein is very important to have in your diet. That's like the
Mhm.
the main thing that you want to make sure you're getting, a big, good amount of
Yeah.
protein in each meal, because protein promotes, everything else, your body function, your brain function, healing, things like that. So, in terms of like if you have a wound and wound healing, the protein. So again, nutrition, very important. Make
Mhm.
sure that you're eating healthy foods, not just that you're eating McDonald's, like, no, you
Yeah.
need to be eating things that are actually like feeding your brain and your body.
Mhm.
And then also exercise, I said, and have an active lifestyle. And this is something that I got as well, another resource from the Mayo Clinic, I believe, just a little more about exercise and how that actually helps to reduce and manage stress as well. So outside of, exercise being good for your physical body, and, of course, everyone, we want to be in shape, we want to
Mhm.
be fit, but for your mental health as well and your stress, exercise, it really does make a difference. And so I just want to read a little here. This says from the Mayo Clinic, exercise and stress relief. Exercise increases your overall health and your sense of well being, which puts more pep in your step every day. But exercise has some direct stress busting benefits. Okay, so this is the part, it pumps your endorphins. Physical activity may help bump up the production of your brain's feel good neurotransmitters, which are called endorphins. It says, although this function is often referred to as a runner's high, any aerobic activity, such as a rousing game of tennis or a hike, can contribute to this same feeling. So it literally does release those endorphins in your brain once you engage in that physical activity and exercise, and it actually does boost your mood, it actually does relieve your stress, you do feel better, but it's easier said than done. Someone who doesn't exercise, when you tell them that, they just are kind of like, okay, they don't believe
Mhm.
it, but seriously, it makes you feel better. It can relieve your stress. And then what else do we have here? It says it reduces negative effects of stress. So, exercise can provide stress relief for your body while imitating effects of stress, so such as the fight or flight response, and helping your body and its systems practice working together through those effects. So, again, this can lead to positive effects, including with cardiovascular health, digestive, and your immune system. It also says, you what's this it helps you to improve your mood. So just overall, I would say physical activity, people don't really realize how many positive effects that physical activity actually does have on your mental health. It has a lot of benefits, and so that's why physical activity is promoted even at a young age. They require that you do PE, right? Everybody has
Yeah.
to do PE. Why is
Mhm.
that? Because it's important to have that activity, to have an active lifestyle, not only, for your physical health again, but also for mental health. So just
Yeah.
remember that.
Yeah. I think that's very good at it. Yeah. That's all I have for, yeah, that's all I have for now.
Okay.
So, yeah. Thank you. Thank you for your time. And I think, I might, come to the facility around next week. So I think it'd be great if we could meet in person as well.
Yes,
So, yeah.
absolutely.
Yeah. Okay. Thank
Okay.
you.
Sounds good. You're welcome.
Bye. Have a
Bye.
good day.
You too. Nice to meet you.